Hello, good morning, everyone. Let's start today with the title of my PhD thesis, Novel Digital Health Approaches in Oncology. I'm Seba Aljomaa. I am a PhD student in the Center for Translational Medicine, and my vision is to improve the quality of life of cancer patients. And let's think about digital health interventions as a new trend in this field. So through these two projects, we are trying to find new solutions via technology for cancer patients. Starting with my first project, comparing the effect of digital health interventions on the quality of life of individuals facing cancer via systematic review and meta-analysis. Because of the impact of cancer on patients' quality of life and its treatment as well, anxiety, pain, and fatigue among cancer patients, prevalence is very high, as you can see, and unfortunately, current standards of care are not enough for this suffering. So, because of the adaptation of technology, especially during the pandemic of COVID-19, which we noticed the emerging of digital health in healthcare in general, and in the light of WHO recommendations, we are looking for digital health interventions as promising tools to improve quality of life for cancer patients. So our aim to investigate the efficacy of these interventions in oncological care. Via XR gaming and also virtual reality, mobile applications and web interventions, we're gonna ask our clinical question. Does e-health, electronic health, and mHealth, mobile health, change the mental and physical health outcomes of cancer patients during their therapy? We're gonna compare these interventions to the current standards of care, and for the outcomes, we are looking for the measurements of different mental and physical outcomes like pain and anxiety, fear, quality of life, and etc. Our hypothesis that digital health interventions could improve the mental and physical health outcomes of cancer patients. And through this systematic search, using these search keys and starting with a huge pool, ended up with about 200 articles. We did this selection, and through these levels, now we are still analyzing the data, and we have finalized the data of the first huge category or main category, which is the games. And I would like to highlight that these games could encourage the patients to improve their physical activity or also to educate them about cancer and adverse events and therapy. Starting with our first blood today, quality of life change differences between gaming interventions and control group, where we are using the standardized mean difference because it takes into consideration the variety of these heterogeneous methodologies in these studies. And basically because our results till now, not yet significant, but it's clinically relevant. So we're looking for more studies, but our SMD is in the moderate range, which is 0.69 with heterogeneity of 27%. So we would say that this gaming could improve the quality of life of cancer patients. And for the second plot, quality of life change after gaming in intervention groups, we are here just comparing the intervention groups in 5 studies using the standardized mean difference to investigate the effect of gaming on oncological care. Also, the standardized mean difference is 0.53, which is moderate and not yet mathematically significant, with also heterogeneity of 93% because of using different methodologies and also the heterogeneity related to the populations. Our third plot today is about fatigue score change after gaming interventions. Also, we are comparing the changing of fatigue between 5 studies using the standardized mean difference. This result is mathematically significant, and also the standardized mean difference is 0.72, which support our hypothesis that this gaming could improve or reduce the fatigue of cancer patients with heterogeneity of 0%. So we are looking for more search. Our strength is that we have several high-quality reports like RCTs and also several measurements tools developed in this field. But unfortunately, the interviews and semi-interviews are used in many studies, and also as qualitative studies, and also difficulties in comparison because of such heterogeneity between methodologies in studies, also population and cancer type. So also I would say that small sample size is in most of the studies, so we are looking for more research. I would conclude that gaming intervention improves cancer patients' quality of life. We are looking for implication for practice, that age-specific gaming interventions should be introduced in oncological care. While on the level of research, we need RCTs with higher number of patients and homogeneous methodologies regarding to age, to cancer type, in targeted population. New age and disease-targeted gaming also should be developed on this level. And now, let me introduce my second project investigating the distracting effect of tablets, virtual reality, and analgesic cream during regular picking of childhood cancer patients. Also in the light of the results of our meta-analysis, we're gonna go through randomized control trial for oncological care in the childhood. Children with cancer, unfortunately, they're suffering not just from cancer and therapy, and also from frequent pricking, that they're gonna get at least once a week a pricking, which means the procedures with needles. And these procedures used to be scary, painful, and also cause distress in children. Until now, the pain-relieving strategies or methods, we have the analgesic creams, which gonna take time, and also some technology resources like iPad and VR glasses, but it's limited till now. Still, the virtual reality is a novel technology with the capacity to distract the patients and guide their focus away from the pain. So, our aim is to define the most effective distracting technique to reduce pain, fear, anxiety, and other problems for childhood cancer patients during regular pricking. So we asked our clinical question: what is the most effective distracting method to reduce pain and anxiety for childhood cancer patients during regular pricking? Our population is pediatric cancer patients undergoing pricking. We are comparing distraction with tablets like iPads during the intervention to distraction with VR glasses, virtual reality technique during intervention, and the comparator is lidocaine plus pyrocaine, which is the analgesic creams, local creams, current standards of care in most of the hospitals. Our outcomes are pain using one-Baker Faces Pain Rating Scale, which is the scale using the faces for different age ranges, and anxiety using multidimensional anxiety scale for children, MASC-10. Satisfaction also using for Likert scale, and our hypothesis that the use of these VR glasses is the most effective to reduce pain and anxiety in childhood cancer patients during such painful procedures. We are looking to the clinical implications of this technology, and we are encouraging the clinicians to use this virtual reality or these techniques to reduce pain and anxiety of childhood cancer patients. For sure, we're gonna support this with our results, and also to encourage the policymakers for harm reduction in healthcare. So all in all, and because of our vision and our mission to improve the quality of life of cancer patients, we are working on these projects in parallel to support our RCT results with the background of with the scientific background through the meta-analysis. Now I'm gonna finish my speech with Albert Einstein: be a loner that gives you time to wonder, to search for truth, have holy curiosity, make your life worth living. Thanks for your attention.
Thank you very much. Congratulations on your work. It's a really impactful topic, so a really good choice. Also, I was wondering, what was the? Can you explain explain a little bit or give an example on gaming, what you investigated in your first study? For me, seeing this presentation first, I don't really understand what you mean by gaming there.
Okay, thank you for your question. Basically, as I say, that gaming could encourage the cancer patients to improve their physical activity by exercise by gaming, which is like Wii technique. And basically, there are commercial available games now. They are specific for cancer patients, like a remission video game, and also another one called Your Shape, Your Fit, I think. On this regard, we are looking for reducing fatigue and improving exercise or level. And on the other hand, I said also we have educational games that we are educating patients more about cancer through the game to know more about the therapy, about adverse events, and also the cancer itself, to destroy the cancer cells. It's like a cheerful, maybe, if it's right to say, environment, but just to educate them more to maybe reduce their fear and anxiety by knowing.
Thank you.
Maybe I have one more question, Seba. If you go to one of your plots about the quality of life, there was one study in the opposite side of the line of no effect. Have you explored the reason behind that?
Okay, thanks for your question. Basically, in this study, first of all, I would like to highlight that we sent an email to the authors because their technique is a bit different, and using their scale also is not in the way that it's in the literature. But for saying what we interpret till now, that the patients in this category are with metastasis, while the others are either with primary tumor or mixed. And what we got that they try to improve their quality of life by reduce the decrease the decrease in quality of life, and because maybe of the circumstances of metastasis, they got it to favor the controls.
And is this the final plot of this outcome, or are you expecting more studies in this outcome?
Basically, this is the final one, but also we got some suggestions to have a reference in these plots, a reference scale, because as you see, we have different scales in each study. So we are looking for another plots, but basically, in this case, yes, it's the final one.
All right, thank you.
Thank you very much for the very interesting presentation. Are you aware of any Hungarian hospitals where they can test gaming, for example, with children in cancer?
Thanks for your question. As I know, till now, no. It's not using, at least in the clinic where we, or in Budapest, as I know. Basically, the virtual reality is used, not too much in limited cases, but I don't think that gaming is used in Hungary now. And I would like to know if any of the physicians tried it before.
Thank you.